Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk this morning about these Class 3 cases. I'm going to show one where we corrected it by removing the lower 6-year molars. And I have a whole string of these cases that we've done this, and they're substantial and they hold up over a period of time. And the way we do it, by moving the lower anterior teeth back some, we bring the upper teeth forward in many of them, and they're stable in most cases. And if they're not, we have a method of retaining the Class 3 cases where over a period of time they'll correct themselves to where the pressure on the outside is the same as the pressure on the inside. And won't somebody, whoever wants to examine these cases and come up with that this is the good way to treat many Class 3 cases. Now, if the Class 3 case has a lot of vertical height of the face, you can't reduce that by this method, but you have to go in and trim the upper arch or lower arch, actually the lower arch, the upper arch where you trim off part of the bone structure around the, up in the sinus area, which is a pretty extensive surgical procedure. Now, so watch this case, and I'm going to show you several more Class 3 cases we've done like this. Now, this was a non, it hadn't been done hardly any. And when I suggested to the parents, I suggested and sat down and showed the parents what we would do, and they said, that sounds good to me. So they went to their dentist and wanted him to take out the lower 6-year molars. He said, no way, he wasn't going to do that. So they came back to me, we went over it again, and they said, it still looks good. And so I called the referring dentist and said, do you mind if I have somebody else take out the 6-year molars, the lower 6-year molars? And he said, well, I don't care if you do that, but I don't want to have anything to do with this case. And so we said, okay, we're going ahead and do it anyway. And so the parents agreed, and the child agreed, everybody, prevent a real surgical thing to do this. Now you watch the case, and you watch the one I showed just the other day about it, and see if this is not a better way to do surgical Class 3 cases where you've got a pretty good facial height in here. So let's get on with this show, and I'll try to move this on fast as we can. This is the young lady right here. It doesn't show to be a real bad Class 3 case, and it isn't really. And I shot this view here. She had her eyes closed. And so here are the teeth, and this is the Class 3 situation that we're in. We've got a more narrow upper arch, you see, so we got other problems here like mouth breathing. And by the way, if you're breathing through your mouth constantly and you keep your tongue in the lower arch will get wider than the upper arch. And it's supposed to be smaller than the upper arch and fit in where the cusp fit inside the upper arch. And so anyway, forget about that right now. Let's think about the Class 3 case here. Now I'm going to show you from this side. Now we're recommending removing the 6-year molars on the lower. Now you want to make darn sure you got wisdom teeth back here, because if you take this out, you want to slide the first molar up, the second molar up in here where the first molar was, and bring the wisdom tooth back in that area back there. And then you'll leave the rest, both bicuspids and everything else, all the way around on the case. And up above, we will take nothing out at all. But we're going to bring these teeth back by moving these teeth forward. And many of these cases need to be double jaw surgery if you get in there on some of them. Now this you could have gotten by without that, but let's have the same idea, bringing this up here, and you pull on this part down here and bring this up out further. On some of these cases, you need a lot of advancement of the upper arch as well as some lower arch moving it back some, and you play the two against it. If you need more room, you put a screw in right behind the second bicuspid back here, and you pull on this harder and bring this out further. And then you bring these teeth, pull these teeth back in. You'll see them back behind this when we get through. Now, check this out. Whoever you are, I don't know where this is going to go, but if you can prove that this is a better way to do many Class 3 cases, it will change things all over the world. There are many, many Class 3s, and people come in. I had this case we did just before this, went to several oral surgeons, and they wanted to do the operation. And she came to me, and I said, well, I think we can do it without the operation. And no, that was the case I did yesterday, the more involved case. Now, this one won't be as involved as that one was, but let's get on with it. We're going to take the 6-year molars out. I didn't do it. I sent them to an old surgeon, and he took them out. He didn't bat an eye. You tell the old surgeon to take it out, he doesn't ask you what. And so he took it out, but the referring dentist refused to do this. He said, I don't want any part of this. And I said, okay. And I went over it again with the parents, and they agreed to this. And so we did it anyway. And it worked out so great. And I kept seeing this dentist at the dental meetings and everything. I said, how's your patient doing? And finally he came across. He said, this is a miracle. And so now we had to widen the arch out because the lower teeth were fitting further on the outside out here. So we used a palatal separator to widen this arch out. So we had these teeth removed, and we moved this out. All right, here we are into the case. Now we've already jumped these teeth here over the top, and we're opening space in here for these cuspids to come through, and that helps your Class 3 problem there. So this is not as bad a Class 3 as a case as it actually looks like. So here we enlarge the space. These are just little flexible wire. We got some spring in here, bringing this cuspid down and this one down here. And if you go, let me go back here and look at the cuspids where they came in. See, these cuspids were coming in like this, like here. And there's one coming in this area right here. So we open that space. So you'll see how much space it had to come in. Now we're just pulling those cuspids down into place. We open this with a palatal separator. And by the way, if you do palatal separation, you ought to band every tooth you have in there so they're rigid. As you go across with them, they carry the crown out, the roots go out with the crown, and that is the airway. Now this young lady was a mouth breather apparently, and the upper arch was more narrow than the lower arch, and the tongue sitting in the lower arch is what widened it out. And they usually a mouth breather doesn't bite as hard down to close that. But when you put in a palatal separator, you ought to band every tooth in there, and when you put cement on it, you should press on this and push the cement out to the bottom so that the crown, the band on the tooth is solid all the way down, the cement down at the bottom. And as I spread these out like this, those molars and bicuspids will kind of tilt a little bit, but not very much. Now these palatal separators that you have made, and somebody will just band the 6-year molar and put a bar in here. And this is not the way to do it, and AI can say that if they want to check it out. I don't care who you are, if you're pushing with a bar, the teeth are going to go like this. The roots will go in a little bit because they're in the bone, but the crown will go out more because they're out in the air. And then that reduces the airway to some extent. Now, if you have these teeth rigidly banded and cemented in, then they go out. They may tilt a wee bit, but it won't be much. You just leave them there for several months on a separator, and their roots will be out where the crowns are, and the airway will be enlarged. And I'll stand on that. That is a true fact, and they can put it in AI or anywhere else you want to put it. But when you expand the upper arch, where you've got a lower arch that is actually bigger than the upper, that's a mouth breather almost without exception. And the tongue is in the bottom arch more than it is when you swallow properly. Your tongue goes up and pushes out on the upper teeth, and everything in there is a total different force matter, and the teeth are going to go. I don't care whose stuff you use to decide where you ought to go in here. In other words, your cephalometric stuff. If nobody knows where that force is exactly the same thing, but you can tell when you go in there if it's crowded up, then you're going to have a problem with it. And I've had a lot of class 3 cases where they did not want to do the upper jaw. That's a real boogaroo doing it. I've scrubbed in and I can know that. And then down on the bottom, they were just shortened the chin, and now they've brought the chin back in, but the upper teeth didn't have room enough for the tongue, and these cases will collapse on them unless you really knew how to put class 3 retention in. All right, let's get on. We can't cover everything mentioned this, but we've opened this palatal separator far enough to get these teeth out over. So we'll start taking this thing off after it's worn a few months, and we got it spread out here. Now down on the bottom, we took the 6-year molars out. We're pulling this back for a ways to where we get all these teeth lined up good. And if you needed to bring the upper teeth further out, you put a pin, or it's a screw really, they call them peg, the name of them. It's nothing but a screw, and they can make the screws out of stainless steel because you're going to take them out anyway. There's no need charging $60, $70, $80 for a screw. You can buy a whole box of screws for less than that. And they ought to make them cheap enough where people can use them frequently. Now, we don't have wisdom teeth, so we're going to pull these teeth up here, and when we get to a class 1 relation, we'll stop. And if you want to pull harder on this to pull your upper teeth further forward, then you put pins in this area right back here. All right, here we are looking at it through an old Panorex type thing, which we cut it down the center, and so you'll have more than 4 teeth across the front here. Now we're going to remove this, and we'll bring this back to a class 1 relationship, and they'll pull this up. Now if this gets to class 1 before this gets here, put your pin in here to hold that, and this will come on up. And now when you finish the case, these wisdom teeth won't be in there, or this one won't be in there, and so we have to have a retainer that holds this tooth in place until this gets there. These teeth are going to move one bicuspid pretty much forward as we go in there. Now here was the palatal separator, and here's how we moved it out, and we had like this is a 6-year molar, this is a second molar, and it looks like there is no wisdom tooth up there. Down here, on the bottom where we really needed the wisdom teeth, we couldn't do this. We wouldn't do it without this tooth here. Now, when we bring these teeth forward, this will have room to come in underneath here. And you watch this. And I want people that's supposed to know what they're doing, examine this. And if I'm wrong in it, let me know. And this young lady, we went through this and it worked out perfect. And then here it is now, we've extracted these teeth. And I've been preaching on this and talking about it for several years. I mean, years. And shown this all over the country and part of the world. And there's very few people, they're scared to do it. They're scared to do this. But watch it do it. All right, we're going to pull those teeth forward. And we got them up here now in this area. Now they're that far forward. Now they brought that tooth up to this area right here. And now we've got a pretty much class 1 relation going through there. And I kept going back to, forgot to cover up the names here, and it won't matter. This young lady is probably 60 years old now. This was done in around 91, so that was 20, nearly 30 some odd years ago. And this is the 9th Panorex now we've done on her. And so we had to put a retainer in there and hold that tooth right where it is to let this one go. This is a wisdom tooth and a second molar, wisdom tooth, second molar. You could not do this unless you had the wisdom teeth. We did not have one up here, but we had one over here. We leave it alone. That's good. And this works out. This may be the last Panorex, I don't know. All right, here we'll show the thing in action if you want to learn exactly what we do here. I hope you people, wherever you are, I don't have any foggy idea who sees these. They go all over the world. And whoever you are out there, I'm trying to explain it enough so that you could actually do this, but you need to learn some orthodontics before you jump in here to start doing this kind of stuff. Now we level that out. We open space with the cuspid, brought them down. There we cut the palatal separator off, but we spread it out first, brought it down here. You could have done it with a big daddy arch wire if you wanted to. Now this is 87, and we're getting just pretty well to the finish. And here it is, a bad picture, but this is the upper part. Now it's lined up. The lower part is almost there. This is the second molar coming up into there. This is pretty much in class 1 now. So we've got this back. You can come in and put this. And this in here is opening this bite and we're still bringing these teeth together back here in the back. And we use this to level this tooth out. In other words, you come in here and you make a deal like that, and you run this down here, and as you pull this tooth forward, it will bring the root and the tooth and the crown forward at the same time. Learn how to use this little deal here. When you're sliding the tooth forward in here, you can turn in here at about the center of this, run in and make here. I'll just make a little deal here and show you, like you have a, when you bend the wire down like that, you come back up, and now you go down this way. And you hook this in a tube on this molar, which would be in here. Now you run this in here, this is going to go down in this direction, but you activate this spring. As you tighten this up, it tightens this spring, and now you tie here, you run this through this deal here, we're going to go through here. And we come in here and tie that, pull on this. If you pull too hard, it'll lean the crown forward. If you don't pull hard enough, the roots will come forward. This is the way to close space, and you can open them and close it. You can do any movement that you can think about with the appliances like I have here, and I hope that you can learn how to do that. I mean, if you had this tooth sitting back here, you could run this, try to get to the middle and then shorten your wire up here, keep this going, and that force going down like that will make this tooth bring the roots and everything. It'll carry this all forward. And that is a fact. And you can write that down, your AI, whoever's doing this, you can pull those teeth forward bodily in this fashion. And I'll stand on that because I've moved many, many, many teeth and closed up many spaces and done restorative dentistry by using the wisdom teeth or anything you got in the back that you can pull up into the front. You can do it with that. So I'm going to skip that now and let's get on with the next slide. All right, here I'm just showing this same thing. Now we cut the palatal separator. I left the bar back here. We did, and we banded this tooth. We'll bring that out. I'm sorry, we jumped out of the pen over here. All right, let's go back. All right, here we go. All right, we're back in there now. We're finishing this case out. Now, I kept seeing this child's dentist at the dental meetings, and I kept asking him, well, have you checked her teeth? I want you to clean them every 2 or 3 months just so you keep up with what's happening. He did not think that we could do this. And nobody, people just throw their head up. You're taking out lower good 6-year molars to do this. You make darn sure you got wisdom teeth if you're going to do it. But it works. And I'll stand on that, AI or none. And they can go check it if they want to. I hope somebody does. I'm going to show several of these cases. And now the space is almost together. We continue going with this. This is 88. Now it's just a little space. Now those teeth have come forward straight like that. They didn't tilt over. We brought the root up, but the thing that brought it up is that little wire. We had it going down like that in there, and it makes the root come forward with the crown. And I'll stand on that. That is a fact. It's not something and it'll be that way 100 years from now. It's the same thing you can do. So that's things, this old idea that 50% of what you know is going to be obsolete. It may be what some people know, but they haven't really thought out the real reason why it's that way, and it'll be that way from now on. It was that way years and years ago. We just didn't know some of it. Now we're just about to finish up. I put little hooks on here and twisted them myself, and we're bringing those teeth to use some class 2 elastics to pull that last part of that down. And now we've got this about finished. The space is a little bit of space, but look at this crown. It's straight up and down. It's not tilted forward like that. All right, here's our young lady after we finished, and it worked out good. I finished hers, she had almost a perfect set of teeth there, but we had to wear a retainer that kept the upper wisdom teeth from dropping down too fast. And I've shown you how to make that retainer. It's in retention of class 3 cases. So if you want to go back to that video and look that up, it'll tell you how to do class 3 cases where the wisdom teeth haven't come in all the way. You hold them up, and also a way of treating them. If somebody just does surgery on the bottom arch, you can fix it where you hold back on this bottom arch, and it'll push both arches forward rather than causing them to redo the whole surgery. Thank you for watching now, and I hope that AI is going to look at these 3 or 4. I'm going to show several more class 3 cases and how we did it with nothing but taking out the 6-year molars and controlling the amount of pressure we put on the lower arch to pull it back. Now, whenever you pull back on the lower arch, you're working with a jawbone. It'll shove the condyle back. Some people with a TMJ problem, you can't hardly wear the elastic. You have to wear the elastic during the daytime when they can keep their jaw forward. At night, they relax. It pushes the condyle into the retrodiscal tissue if you're having trouble with it. Most of these, I have not had any trouble with that. So thank you for watching, and I'll sign up and hope you'll join our deal and subscribe to our channels. We have 3 YouTube channels, and I thank God for YouTube, because we have able to bring all this stuff that I've learned over the last 60 years and shown it to the world. I have not received 1 penny from anybody. I have paid for this myself, and I hope it goes out to the people in the world, and this helps people everywhere. And for God's sakes, if you learn how to do it, share it with somebody else. I taught one man one time. I had a whole bunch of people. I said, get a group around you, anybody in your area, and show them how to do this. And he said, oh, I don't want to show them. I want to be the only one doing it. I thought, well, you silly guy, that's the wrong thing to do. You learn something that you can share with the world that will help other people. Don't keep it to yourself. Share it with other people. And that is the best way in the world to do it. So thank you for watching, and I'm going to hang up here and quit preaching to you. But I hope to goodness somebody will catch on and have guts enough to try doing the 6-year molar deal. Just make darn sure you've got wisdom teeth when you start it. So I'll say goodbye, and that'll finish it up.